Hello everyone, I am Megha Aley, lecturer, Department of Nursing Foundation, Yenepoya Nursing College. Today I will be taking a small session on blood pressure monitoring. So the objectives of today's session is, at the end of the class, students will be able to define blood pressure and list the purpose of blood pressure monitoring, list down the articles, and explain how to measure blood pressure and discuss on special precautions. So now let me introduce what is blood pressure. So blood pressure, it is a result of two sets of forces. Here the force of the heart and the resistance of blood vessels comes together to push the blood through the body circulation system. As the heart beats, it exerts a force on the blood, increasing the overall blood pressure, and as the heart relaxes, there is a less force exerted. So that is the simple introduction of what is blood pressure. So now let me define what is blood pressure in two lines. So blood pressure is a force exerted by the circulating blood against the blood vessels. Okay, very simple. So we are having types, that is systolic and diastolic. I have given the normal range in the slide. Systolic is 90 to 140 mm of Hg and diastolic is 60 to 90 mm of Hg. So now in the next slide we will be discussing what is systolic and what is diastolic. So systolic, it is a peak of maximum pressure exerted on the blood vessel when the heart contracts. And next is diastolic. It is exact opposite of systolic, that is the minimum pressure exerted on the blood vessels during relaxation of the heart. So that was the simple difference between systolic and diastolic pressure. So now why we do blood pressure monitoring? What is the purpose of blood pressure monitoring? So here first and foremost is to know the baseline. So what baseline? Blood pressure baseline for future measurements. It also helps in diagnosis, and it also helps in cardiovascular system assessment, that is prior or after the surgeries, any kind of surgeries, and in general to assess the general condition of the patient. And also we can check whether our medical therapy that we provide is effective or not. And lastly, to determine patient's hemodynamic status. That was the few purposes enlisted. So now what kind of articles that we need in order to check blood pressure? First is the main article, that is the sphygmomanometer. That is, in layman term or in general we call it as a BP monitoring machine, BP, or that is blood pressure monitoring machine. Under that we have that is a parts. Here we will be seeing the parts: compression bag enclosed in a cloth cuff that you can see in the slide. Next is an inflating bulb, that also it is in the slide. Next is a manometer. Here we can read the pressure reading that is given in a numbering. And lastly, a screw type release valve for inflation and deflation. Next is stethoscope and patient chart and pen for charting. There are the few articles that we need during blood pressure monitoring. So now we have listed the articles. Now how we monitor our blood pressure, what we have to do, what are the things that we have to keep in mind in order to check the blood pressure. So first and foremost, very important, we have to check the order: physician order, nursing care plan, and progress note of the patient. After that we have to inform the patient what we are going to do. We have to explain the procedure and take consent from the patient. After that, collect the articles, whatever that we discussed priorly. After that, check of its workability, whether it is properly working or not. Then after that, do the hand washing. Then assist the patient in positioning, either sitting or lying down, but preferably we will be following sitting position. And we also have to apply appropriate size cuff, that is for the adult, pediatric, appropriate size cuff has to be selected. Then after that we have to position the sphygmomanometer, that is the BP machine, approximately at the heart level. So now we have to expose the arm and make sure that there is no constricting cloth. Then we have to apply the cuff approximately 2.5 or 2 cm above the antecubital fossa. It is a point where the brachial artery is palpated. Now after the application, we have to secure the cuff by Velcro fastening. Then the arm has to be well supported and rested. Now next what you have to do is you have to palpate the radial pulse. Now when you are palpating the radial pulse, simultaneously you have to inflate the cuff till the pulse disappears. After that you have to note the reading where the pulse has disappeared. Now the stethoscope has to be placed over the brachial artery that we palpated priorly. Okay, then after that we have to inflate the cuff to the pressure of 30 mm of Hg. Now next what we have to do is we have to slowly deflate the cuff at 2 mm of Hg per second and estimate the systolic pressure. Now how we can know that this is systolic pressure? See here, now when you are deflating the cuff, the first sound that is heard, that is the systolic pressure. Now what you have to do is we have to continue to deflate and note the point at which the manometer we have to note the point on the manometer at which the sound muffles or the sound decreases or stops, that is the diastolic pressure. Now deflate the cuff completely, make sure that the patient is comfortable, and whatever articles that we have used we have to remove and clean it properly and document the reading. After that we have to analyze what is the reading. If there is any discrepancy or any abnormality that you find, you have to report it to the physician. So that was the procedure of BP monitoring. So now we have to see some special precautions that we have to take during BP monitoring. So we should not take blood pressure in the patient's arm or the side of the arm if the patient is in IV infusion or intravenous infusion, and if the patient arm is injured or diseased, or if there is any kind of fistula or sometimes patient can undergo radical mastectomy, so that part should also be avoided, and in some cases when the arm is paralyzed. And also, as I told you before, the BP monitoring has to be done in a supine position, and also the appropriate size cuff has to be selected. Now we have come to the end of the session. So now I will be concluding the topic. So blood pressure is most accurately measured using the mercury sphygmomanometer, that is the blood pressure monitoring machine. Then before measurement of BP, the patient should avoid caffeine or smoking prior to 2 hours. Early detection of high blood pressure is critical in prevention of disease conditions like cardiovascular system conditions or kidney diseases and etc. Thank you.